Have you ever heard of something called Ozempic Vagina? Well, if not, let me tell you about it. It's an emerging term and it describes the changes that happen specifically in your labia, vaginal area called your mons, pubis. When people take drugs like Ozempic, Wegovy, and other GLP-1s. So in this video, I'm going to break down what's really happening, why these changes occur, and what you can do about it. If you're using GLP-1s, understand that there's going to be some side effects. There are going to be some things that are going to be happening because you're taking those medications. We're talking about shifts in your sexual health, hormone balance, and body composition. So make sure that you subscribe and like this video if you get some benefit from it. Let's talk about Ozempic or semaglutide and similar GLP-1 receptor agonists. Now, they're widely known for helping people with weight loss, but understand that rapid fat loss from these drugs can affect several areas of the body, including the skin and the intimate tissues, leading to what's recently been coined Ozempic vagina. Yeah, it is a thing. Now, it's not a medical term. It's more of a colloquial term that describes vaginal and labial changes that follow rapid weight loss with Ozempic and other GLP-1 drugs. And the primary issue is really the loss of like the supporting fat pads in the vulva and the labia. So some women are reporting some sagging, some thinning of the skin, some wrinkling, and also reduced elasticity of these areas. Now, these symptoms aren't like a direct pharmacological side effect, but it's rather like a consequence of what like we call the whole body fat loss is going to be triggered by the medication. So some people do lose fat in other areas that they weren't thinking about losing fat in. Now, some women have described like a reduced fullness and even the contour and the labia majora appearing more like deflated or having like a droopy appearance. And then other women have also described some thinning or less elasticity in their vaginal walls, which, sometimes they're also having some dryness and some discomfort during intercourse. And then some women report weaker pelvic muscles as a result of the overall weight and fat loss. So we're talking about increased lines, wrinkles, and looser skin down there. I don't know if you've heard of the terms Ozempic face or Ozempic butt, but rapid weight loss anywhere in the body can cause some visible skin laxity and some sagging wherever there's fat, including the genital region. Yes, there's fat down there. So you might ask, is Ozempic vagina dangerous? Well, no. These changes are mostly cosmetic and they can affect comfort and confidence, but no, I wouldn't say that they are dangerous. Now, it depends on the individual, but some people have significant skin changes. They report some dryness, irritation, discomfort, which make daily activities and intimacy more challenging. So in those cases, it's always good to follow up with a provider to see if there's anything that you want to do about it. But Ozempic is not directly linked to these things. A lot of the changes in the vaginal tissue are actually secondary to rapid weight loss. Essentially, the skin is not able to keep up with the changes of the body. Now, it's important that if you are having something that is interfering with your daily life, once again, talk to your provider about it. Cosmetic fat loss can cause sagging and hollowing in other areas, like I just mentioned, Ozempic face and Ozempic butt. So if these things are bothering you, make sure you talk to a provider about it, because there are things that can be done. Now, you say, well, what can somebody do about that? Well, if someone is experiencing some significant skin laxity or dryness in the vaginal areas, there might be options like vaginal moisturizers, lubricants, sometimes it even maybe like a topical estrogen, of course, under medical supervision. Gentle skincare is going to be important. Staying hydrated is going to be important. And think about this: gradual fat loss rather than rapid weight loss can actually mitigate some of these symptoms. So it's important to just consult with a healthcare provider once again if you're having symptoms that are disturbing your way of life. I am Dr. Erica R. Jones, MD. I'm a board certified family medicine physician. Just understand that awareness is key. Let your provider know what's going on. Ozempic vagina is a new term that has surfaced lately, but it is not technically a medical condition. Thanks for your time and attention. If you haven't already, comment below. Let me know if you know people who are complaining about any of these symptoms, and we'll sound off in the comments.